Clavicle. It is a long bone which is present horizontally. It has two ends, medial end and lateral end. How to determine the side? The medial end is quadrilateral. It is almost cylindrical or round, whereas the lateral end is flattened from above downwards. So it has two borders, anterior border and posterior border. Now coming to the medial 2/3 of the clavicle. So the medial 2/3 and lateral 1/3. This medial 2/3, the anterior surface is convex, posterior surface is concave. Here in the lateral 1/3, we have two surface, upper and lower surface, two border, anterior and posterior border. The medial end articulates with the sternum and lateral end articulates with the acromion process. So medially sternoclavicular joint and laterally acromioclavicular joint. What are the attachments? So it has four surfaces. Upper surface gives rise to sternocleidomastoid muscle. Anterior surface pectoralis major muscle. To the posterior surface sternohyoid muscle. And to the inferior surface costoclavicular ligament. To the first rib. And in the middle of the clavicle, so in the inferior surface, we can see a groove called subclavian groove. The subclavian groove gives attachment to subclavius muscle, whereas the lips of the subclavian groove gives attachment to clavipectoral fascia. The clavipectoral fascia encloses two muscle, subclavius and pectoralis minor. To the lateral 1/3, we can see a tubercle and a ridge. The tubercle is called conoid tubercle and the ridge is called trapezoid ridge. So here we can see just below the lateral end of the clavicle is the coracoid process of scapula. From the coracoid process to those conoid tubercle and trapezoid ridge, there is a ligament called coracoclavicular ligament. So it has two parts, conoid part of coracoclavicular ligament and trapezoid part of coracoclavicular ligament. And in the lateral 1/3, the anterior border of the clavicle, and this is posterior border. So here to the posterior border we have attachment of trapezius, insertion of trapezius to the posterior border of clavicle, whereas anterior border of clavicle gives attachment to deltoid muscle. The deltoid takes origin here, anterior fibers from the clavicle, middle fibers from the acromion process, posterior fibers from the lower lip of spinous process. What are the peculiarities of clavicle? So it is only long bone present horizontally, which ossifies from membrane. First bone to start ossification and last bone to finish ossification. It ossifies from two primary centers. The bone is pierced by a nerve called supraclavicular nerve, and it has no medullary cavity. These are the peculiarities of clavicle. So what is the applied aspect? The congenital absence of clavicle is called cleidocranial dysostosis. And the common fracture is at the junction of two curvatures, that is medial 2/3 and lateral 1/3. Now moving on to scapula. It is a flat bone, otherwise called shoulder plate. So what is the side? This is costal surface which is present anteriorly. Dorsally we have spinous process. Laterally there is glenoid cavity. So this belongs to the right side. Now what are the three angles? Superior angle, lateral angle and inferior angle. So we have three fossa: subscapular fossa, above the spine, supraspinous fossa, below the spine, infraspinous fossa. And this is called spinoglenoid notch. Spinoglenoid notch. This is called suprascapular notch, which is bridged by transverse scapular ligament. Acromion process, coracoid process and spinous process. So here we have in the subscapular fossa, subscapularis muscle. To the medial border on the costal surface, we have attachment of serratus anterior, 1 digitation, 2 and 3rd digitation, remaining 5 digitations in the inferior angle. Lateral border in the costal surface of scapula has no muscular attachment. Now moving on to the dorsal. Here supraspinatus muscle, below the spine is infraspinatus muscle, and to the lateral border teres minor, and just below that is teres major, and below that is latissimus dorsi. To the medial side rhomboids minor and major, and above in the superior angle is levator scapulae muscle. To the upper lip of spinous process is trapezius, lower lip is deltoid. So we have posterior fibers of deltoid. To the coracoid process, to the tip we have short head of biceps and coracobrachialis, whereas to the anterior surface of coracoid process is insertion of pectoralis minor. And this is glenoid cavity to articulate with head of humerus. Above we have supraglenoid tubercle, below we have infraglenoid tubercle. Supraglenoid tubercle long head of biceps, infraglenoid tubercle long head of triceps. Near suprascapular notch is inferior biliar femohyoid. This notch is covered by transverse scapular ligament and converts the notch into suprascapular foramen. Suprascapular nerve passes below the ligament. Suprascapular artery passes above the ligament. So what is the applied aspect of scapula? To the medial border of costal surface of scapula is the attachment of serratus anterior. So when the nerve is affected, it leads to paralysis of this muscle, which results in winging of scapula. Thank you.